Hi guys, BreeAnn, Allred, physical therapist and pelvic health specialist. I'm here today to talk to you about pelvic organ prolapse. Now, if you've ever heard of this, you are ahead of the game because most women will not even know about this unless they've had an issue with it. So pelvic organ prolapse is where we get a loss of structural support in our pelvic region. So our pelvic organs, the bladder, the bowel, and the uterus are supported by our pelvic floor muscles and several ligaments and fascia that reside in that area. Fascia is like a kind of a tendinous sheath that's in there. When we go through childbirth and pregnancy, often these structural supports to our bladder, our uterus, and our bowel are stretched and sometimes torn and damaged during delivery. With these structural supports being damaged, some women may have symptoms right away where you'll feel a bulge in the vagina. You'll have difficulties emptying your bowel and your bladder because things have fallen into the vagina just a little bit because of a loss of their support. Perhaps the uterus is sitting a little bit low and kind of blocking the ability for the bladder and the bowel to empty. Maybe you're having incontinence, and that's because things are moving around too much for things to be able to tighten and control those issues. There are lots of symptoms of pelvic organ prolapse. I would say the primary complaint that my patients with pelvic organ prolapse complain of is a feeling of a bulge in the vagina. And that bulge is oftentimes not painful and sometimes not really even symptomatic, but that it's uncomfortable and they can feel that sensation. These issues also become a very big problem, even if they weren't a problem earlier after childbirth. We see a lot of issues with this after menopause. In menopause, one of our major hormones, estrogen, significantly drops. Estrogen is a rebounder in our body. That's my best description. So when you let an elastic stretch and you let it go and it rebounds back, that's a lot of what estrogen will do in our body. So you can see as we go through menopause and we lose estrogen, things tend to sag a little bit more. And unfortunately, it contributes to wrinkles, but also with these pelvic organs, they tend to sag. Now, if we have pelvic floor dysfunction or inadequate strength in our pelvic floor at these times as well, which is common, then we are at very high risk for having a pelvic organ prolapse. Treatment for pelvic organ prolapse can include a lot of things, but one of the main things that we do is to increase strength from below in the pelvic floor musculature. And I'd encourage you to refer to our earlier videos on how to do a Kegel correctly and how often to do Kegel exercises for building strength. The other factor that we'd be looking at with pelvic organ prolapse is what is happening within the abdomen and the pressures that are pushing downward in the body. So we work to kind of change the relationship or ratio of these forces and kind of decreasing pressures in the abdomen and increasing strength from below in the pelvic floor to treat these issues. Most women will have improved symptoms with physical therapy or pelvic floor strengthening. So I would recommend that you try some strengthening on your own. And if you're not having success within about 2 or 3 months of doing those exercises, it is beneficial to go get some professional help from a pelvic floor physical therapist.